Welcome to Chit Chat with Gina, your host Gina Barbera. Today we're visiting with Brian Babcock with Health Markets Insurance Agency. By chance, are you in the market for health insurance, or maybe you have questions about what you have, your coverage, you're not sure, maybe you're a little confused in regards to your health plan currently or Medicare plan? Today we're visiting with Brian Babcock, who has over 10 years experience and has over 200 plus 5-star reviews with Google. So we are just excited to be with Brian. Thank you, Brian, for making time finally.
It's a pleasure.
My gosh.
Yeah, it's awesome.
Yes, I know you've been super busy, and just recently you just finished with the Medicare season. Is that always kind of a challenge, just trying to get through all of those times? Or?
Oh, it's a busy time. You kind of give up on a lot of things and have a good support system at home, and that really helps out a lot.
Yeah.
So,
isn't Medicare usually typically around October to December? Is that right?
Always October 15th through December 7th. And then there's the follow-up after that. And then there's a new period right now we call open enrollment. So for the next 3 months, people can make changes.
Oh,
so
okay.
It's still going. It becomes a year-round business. It really does.
Okay. So tell me a little bit about Health Markets Insurance Agency. What exactly type of insurance plans do you offer?
Well, first of all, Health Markets Insurance is based out of North Richland, Texas, a little suburb outside of Dallas. We have agents in all 50 states, and I actually provide all things healthcare related.
Okay.
So whether that be, we refer to it as under 65, individual healthcare through the marketplace, and that's anyone who maybe is working right now, employed, and their employer does not offer healthcare. That's where they would come to me. If there's somebody who may have been covered through an employer, left the workplace, and now has become self-employed as well, I can help them. Sometimes children or dependents turning 26 no longer can be carried on their parents' insurance, so they need health care coverage as well. And of course, Medicare is the over 65 and older. There are 10,000 people a day turning 65 in this country for the next approximate 10 years. That's a lot of people. So Medicare and all things related to Medicare. So whether it's Medicare, original Medicare coverage where people need a Part D plan and a supplement or Medigap, as well as Medicare Advantage plans, all things Medicare.
Okay.
And of course, I also do plans that help to supplement or cover your out-of-pocket costs, expenses for accident, injury, hospitalization, as well as critical illnesses such as heart attack, stroke, and cancer plans, because those are the things that really will take a big dip in your savings and maybe even wipe you out financially.
Wow.
If not properly prepared for.
Do you also do long-term care? I thought I saw something, or am I mistaken?
Yes, we do have a long-term care provision, or I'm able to provide that as well.
Okay.
Yes.
Okay. So all healthcare type of insurance, long-term care,
short-term
care,
Medicare,
everything with care.
Yeah. And it's all because I care.
There you go. I was just going to ask you, so you've been in the business for quite some time. What do you enjoy most about what you do?
That's a great question, Gina. What I think I like most about this business is that I'm helping people, truly. People need help, they have a need, and as I like to say, I have a box full of solutions that all I have to do is reach down and be able to put that solution with their need and solve that problem and take away the stress, the anxiety, the concern, the worry that people have about health insurance, and it really changes people's lives, putting their mind at ease and taking one thing off their to-do list and giving them the coverage that's important to them and what they need.
Is there some common mistakes that people make when they're purchasing insurance? Or is there even such thing as a mistake in insurance?
Yeah. I think one of the most common things that people find themselves in trouble with is trying to do it themselves.
Okay.
Trying to shop for a cheaper price or a cheaper plan, inputting the wrong data or information online can deliver them the wrong policies and premiums and deductibles and co-insurances, and you could see that's a mouthful.
Yes.
And a lot of people, once they start the process, will get into that knee deep, and then before they know it, they're up to here, and really that's when they call me and I have to throw out the lifeline.
Oh, wow. So if somebody has some health insurance plans, or would you be able to sit with them to just kind of figure out what they have is even, I guess, appropriate?
Absolutely.
Or make some suggestions if they need to do something that could possibly save them money and have more coverage? Is that even possible?
That's very possible, and that's absolutely one of the things that I like to do is invite, if somebody does have a current policy or plan that they're covered for or by, bring that in.
Okay.
Let me look it over, let me review what you have and help explain what you have, because that may be the best plan for you, but if it's not, we can certainly look at all the options that you have available to you, and then help you, the client, make the best decision for you to get the best coverage, the best price, and one thing off your to-do list.
Okay, sounds great. And so what would be something people would be surprised to learn about Health Markets Insurance Agency?
Well, the name may not be a household name, but we have been in business for over 30 years. We have recently been brought under the United Health Group umbrella, which is a global billion-dollar healthcare provider. And we have agents in all 50 states. So no matter where you go, where you travel, where you move to or from, we always have agents available to help you the health markets way.
Okay, and what areas do you typically cover?
Great question. I'm actually licensed and appointed in the great state of Texas,
Cool.
as well as Oklahoma, and also in Florida.
Wow, okay, so someone sees this video and they happen to be in Florida, they can still reach out to you.
Absolutely,
And you can help them.
absolutely.
Okay, okay. Is there anything that you want to add that you think is important for people to know?
I think, 200 plus Google's 5-star reviews can't be wrong.
No,
So
that's a lot of great reviews.
don't be afraid to reach out, and don't be afraid to make the call or the text, the email, go through my website to find out what I can do to help you choose the best plan at the lowest cost and make sure that it is the right plan for you and your family, and of course anybody near and dear to you and all those good folks that you as a potential client may know and love and care about. I'm here to help.
And you're also a veteran, aren't you? Or
Yes, as a matter of fact, retired Navy veteran with 20 plus years, United States Navy.
well,
Yeah.
thank you for serving our country. So
Thank you.
All right. So we're going to display the information so that you can get a hold of Brian. And we thank you for joining us. Bye-bye.
Thank you, Gina.